The next procedure that I'd like to talk to is that of facial resurfacing. Chemical peels, lasers, dermabrasions. I tell people they're all the same in the sense that they're all ice cream. One's vanilla, one's chocolate, one's strawberry. For the most part, when I do resurfacing, which is generally designed to go ahead and eliminate surface blemishes, skin irregularities, dyschromia, or abnormal discoloration of the skin, fine lines and wrinkles, we usually will resurface the skin. Now, if I'm seeing somebody in my office, I'm going to do extensive resurfacing, like for example, maybe almost the whole face, I generally will put them on a skin care program several weeks before the resurfacing in order to prepare the skin. It's sort of like getting ready to run a marathon. You're not going to go out tomorrow. Maybe some of you can. I know I can't go out and run a marathon and do 26 miles right off the bat. You sort of have to gradually build into it. You run a mile, you run 2 miles, 5 miles, and prepare your body. Same thing is true with resurfacing. So if you're going to be doing some resurfacing, you want to prepare your skin for that with a skincare program prior to doing the resurfacing. Now, what are some of the risks associated with resurfacing? Number one, you can get swelling. Generally speaking, the swelling is not too bad. So what I normally tell patients post-peel is to keep your head elevated, because gravity brings everything down. Number two, if you want to put some ice compresses on your face to minimize that, that's perfectly okay. Usually after several days, the old skin will start to separate. You'll get new skin. So it's important to keep that area lubricated so it doesn't dry out and crack. So I tell patients, put some Lacrolube on there, put some Aquaphor on there, an antibacterial amine. The idea being, keep it soft, keep it moist, keep it lubricated so it doesn't crack and peel. Now, once the old skin separates, the new skin will be red. So it's very, very, very important that you protect that skin from the sun, because it's like new skin, like a baby skin. It's going to be very, very sensitive to the sun's rays. So if you're not careful, you can get hyperpigmentation, that is darker, or hypopigmentation, that is lighter. So while that skin is healing and still in that red phase, it'll be red and light red and pink and light pink. It's important to put a sunblock on, shield your face from the sun, minimize sun exposure as much as you can so you avoid that. Sometimes you might get little whiteheads, little milia, and generally these are just treated with a little abrasion where you take a gauze or a washcloth and just abrade firmly, and usually they're unroofed and they'll be fine. But the big thing is the hypopigmentation, and it's important to avoid excessive sun. And when you do go out in the sun, until that does fade, put on a good sunblock, have good sun protection.